Hello, today I'll be talking about how to care for a patient with a lower leg amputation. So first of all, we need to talk about what an amputation is. So an amputation is the surgical procedure of cutting off a limb, and today specifically I'll be talking about lower limb amputations. So the most common types of lower limb amputations are above knee, below knee, and the amputation of the foot. So now we're talking about the reasons why someone would need an amputation. For example, if the patient has circulatory diseases like peripheral vein diseases or even uncontrolled diabetes, sometimes an amputation is required. Moreover, gangrene and accidental injuries also require an amputation. Now I'll be demonstrating how to take care of a patient with a left leg below the knee amputation. So this is a patient, and as you can see, she has below the knee amputation on her left side. So the patient should always be kept in a supine position, and the legs should always be flat against the bed. The patient should not have any pillows under her foot or on the head side, because if the patient is elevated, it can promote hip flexion as the leg is not there anymore and there's no weight to prevent that from happening. Moreover, the patient's legs should not be abducted or flexed. Again, this can promote hip flexion, and due to there being no weight anymore on this side of the leg, there's no preventing it. Also, as this patient has the below the knee amputation, it is important to never flex the knee of the side where the leg is amputated from, because this can reopen the wounds, and the stump, which is the part of the leg after the limb has been removed, will not heal anymore. The patient's legs should always be in the adduction position, and no pillow should be placed in between the patient's legs. Moreover, the patient should be turned to a prone position twice a day to help prevent the formation of bed sores and pressure ulcers. Now we're talking about phantom pain. Phantom pain is a sensation where the patient who's had a leg or a limb removed feels as if that leg and limb is still attached to them, and they're experiencing pain in that area. This is a very real condition that affects more than 90% of amputees, but there's no care for it because this is mostly a psychological problem.